Hello everyone, I hope you all safe. This is Dr. Nerd. In this video, I'm gonna go over definitions of symptoms and signs that are seen commonly in the cardiovascular system, in scenarios of the cardiovascular system. So let's go over them. So if I ask you, can you feel your own heart beating at this moment without checking it? Well, normally you shouldn't, but if you are, and it's pounding in your chest and so, this is palpitation, and it could be quite irritating. Now, there are many causes, cardiac and non-cardiac causes. Now, under cardiac causes, there are cardiac arrhythmias, which are important in particular, which because they may lead to death, and there are certain group of diseases called structural heart diseases that could also induce palpitation. And there are some systemic causes. Some drugs may induce palpitation, some substances, and certain psychological events and disorders. Now, if we talk about the systemic causes, these are a few examples. So, hyperthyroidism, fever, hypoglycemia, electrolytes imbalance, postmenopausal syndrome, and anemia, pheochromocytoma, and many others. Now you need to ask about drug intake, like beta agonists, anticholinergics, pump inhalers for patients of asthma, vasodilators, and other diseases. Drugs, sorry. But you have also to ask about drugs withdrawal, because certain drugs, like beta blockers withdrawal, may induce palpitation. Some substances like alcohol, caffeine, nicotine, cocaine, heroin, weed, and other drugs of abuse. Now, under psychological, there is anxiety, depression, panic attack. But before deciding that it is psychological palpitation, you have to rule out all the other causes before deciding if it's psychological or not. Even if the patient has a history of some psychological event like panic attack or so, you have to rule out others because, as I said, some may lead to death. Now let's talk about syncope. Syncope is a short-lived loss of consciousness or transient loss of consciousness. What are the causes? There are cardiac causes like bradyarrhythmias and so, and there are non-cardiac causes that are shown in this diagram. So you have to take a good history and do blood work because you wanna make sure that there is no hypoglycemia, no intoxication. You have to pay attention to the neurological symptoms and signs because it could be because of cerebrovascular diseases. It could be because of trauma, or it could be because of seizure. So you have to ask about all the other symptoms. And that's syncope. Now, the jugular venous pressure. It's really a very important term. So I'm gonna leave a link in the description that talks about it in details and how to calculate it and how to measure it and everything. But I'm gonna talk about this diagram here, which shows the jugular cycle or the jugular pulse waves. Before I start, I just want you to know that the jugular venous pressure is the exact same as the right atrial pressure. You will find more details about it in the video. So yes. Now, when we talk about the jugular pulse waves, we have to look at the cardiac cycle, but for the in the right atrial perspective. So it starts by the contraction of the atria, which is the A wave. Now the atria is contracting. That's so this is the pressure, and the y-axis is the pressure, and the x-axis is the time. Now, so it starts with the contraction of the right atrium, and then the pressure decreases because the atria starts to relax. And then the right ventricular contraction starts, as shown here. So systole and diastole of the ventricle, particularly the right ventricle. And when it first contracts, the tricuspid valve will bulge into the right atrium, and that's what uh, is shown here on the C wave. Now there is this huge depression in the pressure, which is referred to as the AX descent, which is the second part of the AX descent. The first part was here, which is the relaxation of the right atrium, and the second part is this part. So what is this second part of the AX descent? It correlates to the bulging of the right atrium because of the negative pressure that's created by the right ventricular contraction. So when the right ventricle contracts, the size of the heart decreases in a sense, leaving a space, vacuum, so negative pressure. So the right atrium will bulge to compensate for that negative pressure, which will lead to this negative pressure on the jugular vein, aka the right atrium. Then blood will start to empty into the right atrium, which will lead to increase in the pressure, and it peaks at the V wave. Then there is this decrease, which is called the VY descent or the YV descent, which is caused by the opening of the tricuspid valve and the passive filling of the right ventricle. And then the right atrium prepares for contracting, and that's lead to an increase in the pressure. And the cycle continues. So it's really important, guys, to watch the video in the description, because it talks about the jugular venous pressure in general, and it talks about this cycle in details. Now, cyanosis. So what is cyanosis? Cyanosis is bluish discoloration of the skin, and it's not caused by hypoxia, as you may think. It's actually a result of the increase of the deoxyhemoglobin in the blood. In fact, there is this value, 5 gram per deciliter, which is at or beyond, the cyanosis will appear. If the deoxyhemoglobin, like 5 gram per deciliter of deoxyhemoglobin appears in the blood, cyanosis will appear, and beyond that. Now, there are two types of cyanosis, central and peripheral. So they will tell you that central cyanosis appears in congestive heart failure and in congenital cyanotic heart diseases. Peripheral cyanosis will appear in congestive heart failure as well as in peripheral vascular diseases. In the upcoming videos, we will talk about diseases that may result in cyanosis, so don't worry about that. Now, chest pain. It is by far one of the most common symptoms seen in cardiology. In the upcoming videos, we're going to talk about the characteristics of chest pain for certain cases like angina, heart failure, and so. But for now, I just want to mention that chest pain could be seen not only in heart problems, because if you can see the chest, there are many tissues and organs, there are muscles, there are bones, some vessels, the esophagus, some nerves, the pulmonary system, as well as the heart. So not each chest pain is MI or something, but never ignore it, because it could be because of heart diseases and so on. This brings us to the end of the video. these are the resources. It wasn't like very heavy. We're still taking it step by step till you guys get familiar with the topic. So, yeah, this is the end. See you.